Hello everyone, and welcome to our new webinar called A Healthy Mood Naturally. My name is Chantal Anne Dumas. I'm a naturopathic doctor in private practice in Montreal, Quebec since 1998, and I'm also a medical advisor for AOR. So today we will be looking into mood disorders, so the facts behind the mood disorders. We will look into more details into two of the most important mood disorders, namely anxiety and depression. Then we will look in more details into the functioning of the different neurotransmitters involved in mood disorders. And we will also have an overview of the risk factors with more emphasis on stress, because stress is definitely one of the major risk factors to develop mood disorders. We will also have a look at the different associated physical health conditions that are related to mood disorders, particularly hormonal imbalance as well as thyroid disorders. And then, of course, we will look into the different ways to achieve a healthy mood balance naturally, starting with lifestyle, then looking at diet and, of course, nutritional supplements. As we all know, feeling down now and then is very normal, and everyone feels anxious from time to time. It's a normal response to stressful situations. It's just the way our body reacts in front of stressful events. We will feel a certain amount of anxiety, and if it's not resolved, it can move on to depression. So that is a normal, typical reaction. But severe or ongoing feelings of anxiety and depression can actually be a sign of an underlying mood disorder. The mood disorders are conditions that cause people to feel intense, prolonged emotions that negatively affect their mental well-being, physical health, relationships, and behavior. And the key words here are intense and prolonged. So mood disorders show no discrimination. They can affect children, adolescents, and adults of any age, no matter what their ethnic background is, sex, social condition, or level of education. The mood disorders include a wide variety of states ranging from depression to anxiety. One of the most common mental illnesses in the general population are actually mood disorders. The combined anxiety disorders affect approximately 12% of Canadians, while major depression will touch about 8% of people at some point in their lives. The onset often occurs during adolescence, but as we mentioned, it can happen at any time during your lifetime. So they also may occur once or twice, or they could be reoccurring on a frequent or regular basis. Mood disorders have a major economic impact, not only in terms of healthcare costs, but also in terms of lost productivity. Individuals with mood disorders are at high risk of committing suicide. So very, very important to recognize mood disorders, and more importantly so, to be able to help yourself or people in your surroundings. So let's start with anxiety. So anxiety can be understood as an exaggeration of a normal body reaction to stress. Everyone feels anxious in response to specific events. For example, you're looking into cuts in your company and thinking that you might lose your job. So that will trigger an anxious reaction in most people. But individuals with an anxiety disorder have excessive or unrealistic feelings that interfere with their lives, in their relationships, school and work performance, social activities, recreation, and so on. So, for example, to keep up with this example of the job, a person that has anxiety will feel this emotion even if there is no particular events going on in the company. They will just be having recurrent thoughts and fears about losing their job, even if these thoughts are not realistic given the context. So excessive anxiety, fear, or worry will cause people who suffer from these feelings to avoid situations that might precipitate the anxiety, or they might also develop compulsive rituals that lessen the anxiety. How do we know if we're actually just experiencing everyday normal anxiety or if we are suffering from an anxiety disorder? So here are some examples here that we can look at. For example, realistic fear of a dangerous object, place, or situation. Jumping off a bridge is, of course, something we should fear. But irrational fear or avoidance of an object, place, or situation that pose little or no threat of danger, for example, exaggerated fear of germs would be an example of that. People with OCD, obsessive-compulsive disorder, needing to wash their hands 15 times just to make sure there are no germs that might affect their health would be an example of an exaggerated reaction. So different type of anxiety disorders. We are looking at generalized anxiety disorder, or GAD, post-traumatic stress disorder that will follow a very stressful event. For example, you know, a war situation would be such a situation. All the various phobias, we just mentioned height, but we can also think about social phobias, you know, people who are afraid of crowds. It could be quite incapacitating. Panic disorders, which will generate panic attacks and other related symptoms, and then obsessive-compulsive disorder, such as what we've just mentioned. So let's look into generalized anxiety disorder. It's basically a severe ongoing anxiety that interferes with day-to-day activities, and it may be a signal of generalized anxiety disorder. So as you've noticed, we've mentioned a lot interferes, because if you're just suffering from normal day-to-day anxiety, you will still cope and manage. But when the anxiety starts having a severe impact on your day-to-day activities or relationships, and this is when we are looking at something that is more on the side of a disorder. So generalized anxiety disorders share common features with panic disorder, obsessive-compulsive disorder, and other types of anxiety, but they're all different conditions. You can develop generalized anxiety disorder as a child or as an adult, and as we've mentioned, you can have a couple episodes in your lifetime, or it could be something that reoccurs on a regular basis. So here are some of the symptoms of generalized anxiety disorders. It could be a constant worrying or obsession about small or large concerns, restlessness and feeling keyed up or on edge, fatigue, irritability, difficulty concentrating or your mind going blank, muscle tension or muscle aches, you know, that have no other explanations, for example, trembling, feeling twitchy, trouble sleeping, sweating, nausea, etc., etc., etc. We've also mentioned that generalized anxiety disorder can happen at any time in your life. So here are some of the symptoms that are more particular in children and adolescents. So these symptoms would be in addition to the other anxiety symptoms that we've just reviewed. So for example, an exaggerated anxiety regarding performance at school or sporting events, being obsessive about being on time, feeling overly anxious about fitting in, being a perfectionist. These are all little signs that might, you know, trigger some concern. Now, the flip coin of anxiety, depression. Depression is a very, very common disorder. It affects up to 1 in 5 people, and it's a condition in which a person feels discouraged, sad, hopeless, unmotivated, or disinterested in life in general. Again, we might all happen to have days where we're feeling a little blues, but we're talking about sadness or discouragement that will interfere with our day-to-day activity and that will last for at least 2 weeks. So the characteristic of a depression is having 1 or more major depressive episodes that will last at least 2 weeks, or depressed mood or loss of interest in usual activities accompanied by at least 4 additional symptoms of depression. So here are the symptoms of depression: persistent sad, anxious, or empty mood, feelings of hopelessness, pessimism, feelings of guilt, worthlessness, helplessness, loss of interest or pleasure in hobbies, activities, including sex, decreased energy, fatigue, feeling slowed down, difficulty concentrating, remembering, making decisions, insomnia, early morning awakening or oversleeping, also a sign of depression, low appetite and weight loss or overeating and weight gain, restlessness, irritability, persistent physical symptoms that do not respond to treatment, such as headaches, digestive disorders, or pain, for example, for which no other cause can be diagnosed. Thoughts of death or suicide attempts. These are major, major signs that absolutely should call for your attention and for professional help. Some other forms of depression include dysthymia, which is basically a less severe form of depression, but it is more long-term, more of a chronic form of depression. And we have bipolar disorder, once called manic depression, and bipolar disorder is characterized by a mood cycle that shifts from severe highs, which are called mania, or mild highs, hypomania, or and severe lows, which are the typical depression phase. We also have seasonal affective disorder, which is very, very frequent in our northern climates. So they are related to changes in seasons and diminished exposure to sunlight. So very common, a lot of times underdiagnosed, and very, very easy to correct with special light and the various supplements that we will be looking at later on during the webinar. And then, of course, we have the postpartum depression, which is a common type of depression that occurs in new mothers between 2 weeks and 6 months after delivery. Now, there is a question that I often get in clinical practice. People are not sure whether they have depression or anxiety or a little bit of both. So depression and anxiety, can I have both? Well, the answer is yes. Individuals severely affected by anxiety disorders are also more likely to have either another type of anxiety disorder, major depression or dysthymia, alcohol or substance abuse, or a personality disorder. The substance abuse is also a common sign or symptom of people being actually self-medicating because of their experience of, the mood disorder, either anxiety or depression. So anxiety may occur as a symptom of clinical depression, and nearly half of the people diagnosed with clinical depression are also diagnosed with anxiety disorders. So depression can be triggered by an anxiety disorder. So as we can see, they often go hand in hand, and we have what we call the anxiety cycle. So the anxiety can trigger panic attacks or panic episodes, which will then lead into depression, which creates more anxiety, more panic, more depression, and so on and so forth. There are a lot of common symptoms between depression and generalized anxiety disorder. If you look at the diagram here, we can see that most symptoms of depression can also be found in anxiety, and all of the anxiety symptoms can actually be found into depression. So what causes those mood disorders? The truth is that it's not fully understood. But what we know is that it's likely the development of the interaction between the genetic, biological, developmental, and other factors such as socioeconomic and workplace stress. It's really, really a complex interplay of different factors. We also know that it may involve naturally occurring brain chemicals that are called neurotransmitters, and the most important ones that are related to moods are serotonin, which is a calming neurotransmitter, dopamine, and norepinephrine. So any kind of imbalance between the neurotransmitters will also affect your mood. So how do neurotransmitters function? The brain transfers signals by way of neurons sending impulses to one another through a network of junction caps between nerve cells that are called synapses. Neurotransmitters modulate various functions in the human body, such as sleep, mood, appetite, for example. And imbalances in neurotransmitter levels can result in serious health problems, including more mood disorders. GABA is the most important inhibitory neurotransmitter, which means the most important calming neurotransmitter. And serotonin is also a very, very important neurotransmitter that contributes to feelings of well-being and happiness. So basically, the way it works is that neurotransmitters are sent between the two neurons, as we can see here, and they will act as little keys in a lock that will produce the signal. And we have a certain amount of time for each neurotransmitter to transmit its signal, and then it will be degraded by different enzymes in our body. So we can use certain supplements to increase the amount of these neurotransmitters, and there are also some pharmaceutical drugs that act as inhibitors of the degradation of these neurotransmitters. So here is a very, very important pathway, which is called the serotonin-melatonin pathway in our body. So the way we produce serotonin, this very important neurotransmitter related to mood, is through the breakdown of proteins. So the proteins go in our stomach. They are digested by our stomach acids. One of the very important amino acids that is related to mood is L-tryptophan. L-tryptophan will be converted into 5-hydroxytryptophan by an enzyme called tryptophan hydroxylase. And that enzyme is actually activated by cofactors such as vitamin B3, folates, and iron and calcium. So a deficiency in any one of these vitamin or trace elements will actually inhibit this enzyme, so it will block that important pathway in the production of serotonin. Then 5-HTP or 5-hydroxytryptophan will be converted into serotonin by dopa decarboxylase, and that enzyme is in turn activated by vitamin B6, vitamin C, zinc, and magnesium. So vitamin B6, we will look into more depth, is very, very crucial to that serotonin-melatonin pathway. And in fact, a lot of people who are consulting for depression are actually deficient in that vitamin B6, so very, very important. Vitamin B6 has a active form that is called P5P for pyridoxal 5-phosphate, and this is the form that we will suggest in case of chronic depression, for example. And then serotonin will be converted into melatonin, which is very important for your sleep. So let's look into the risk factors now. So being female is actually #1 factor because we have a 2-to-1 ratio of diagnostic of mood disorders amongst female. Now, it is possible that females simply consult more, so we have an overrepresentation of that population. But what we do know is that in terms of numbers, we do have a 2-to-1 ratio. Then people who have suffered important childhood trauma are more at risk of suffering more mood disorders. Genetics also play a role. People in certain families seem to be affected more than others. And actually, it is very likely that people in these families have a polymorphism on that B6 transformation vitamin that I was mentioning, the P5P. Substance abuse. Now, whether substance abuse is the cause of anxiety or depression, or if people self-medicate because of anxiety and depression, is not always certain, but we do know that there is a correlation between the two. Certain personality are also more prone to anxiety and depression. Then chronic illness, of course, will trigger often anxiety or depression or both. And as we've mentioned earlier, stress is definitely the most important risk factor for both anxiety and depression. So what is stress, really? Stress is basically an adaptation response from our body in front of a traumatic situation. So the first thing the body does is it goes into the alarm phase, which is the immediate response to the stressor. Now, the stressor can be something very tragic, such as the death of a loved one, But, for example, physical exercise can act as a stressor. A good news can act as a stressor because it will still trigger that reaction, that hormonal response in your body. So your body will still go into an alarm phase. So whether positive or negative, any kind of situation that requires your body to adapt will act on your body as a stressor. So first, the body will go into the alarm phase, and then some key important hormones like epinephrine, renin, aldosterone will be secreted. And these hormones will trigger a whole host of physical and mental reactions. And then we will move into the resistance phase. If the stressor keeps being there, or if we keep facing that stressor, we need to resist and adapt to that stress factor in our life. And then we will start producing different hormones and different neurotransmitters as well to adapt to that stressful situation. If the stressful situation does not go away, of course, this hyperreaction in our body will lead us to the exhaustion phase. And that can, of course, be very detrimental because it may involve the collapse of different vital systems. So chronic stress is actually very, very detrimental for our body as a whole. So one of the common signs that we see in clinical practice is what we call adrenal fatigue or adrenal exhaustion. And it's basically people who have been experiencing acute stress that has turned into chronic stress for such a long period of time that the body is getting exhausted. And now they're starting to have signs such as anxiety, depression, but they can also have a lot of hormonal imbalances because stress does affect our hormones. Stress will increase the activity along the axis between the brain and the adrenal glands. So the adrenal glands are those tiny glands that are located above your kidneys, and these glands secrete the stress hormones in our body, such as cortisol, epinephrine, and norepinephrine. Now, cortisol is extremely, extremely important because not only does it have an important role in our immune system, but it will use progesterone as its primary raw material. So progesterone is the hormone that dominates the second part of your hormonal cycle. So if you notice that, you know, from your ovulation till your period, it's a time where you're overly tired, irritable, and all of the above, then it might be just because of stress. The stress is actually depleting you from your progesterone. Then cortisol will also impair the conversion of your thyroid hormones. So it will prevent your T4 to be converted into T3, the active form of thyroid hormone. Secondly, epinephrine and norepinephrine, those stress hormones, use tyrosine as their precursor, and tyrosine also is a precursor to thyroid hormones. So you can see already that stress will be very detrimental not only to your menstrual cycle, but it will also be detrimental to your thyroid. And then thyroid disorders might in turn trigger mood disorders. So everything is related. Compromised adrenal function profoundly affects hormonal balance because before menopause, so in your premenopausal years, the adrenal function will contribute about 35% of your thyroid hormones. But after menopause, it's more than half of your hormones that come from your adrenal glands. So of course, if your adrenals are already exhausted because of their constant need to produce stress hormones, you will not have a good premenopausal or menopausal cycle. So overtaxed adrenals can also lead to hypothyroidism for the reasons that we just reviewed. Other associated physical health conditions, so we've mentioned menopause, hormones, hypothyroid, but headaches can also be the cause or the consequence of mood disorders. Diarrhea and constipation, nausea and vomiting, GERD, heart disease, high blood pressure, and even osteoporosis, because cortisol will very negatively affect the way your bones are incorporating the calcium. So stress really, really affects just about any system in your body. So hormonal balance, well, it is well known that mood disorders can be caused or worsened by many medical illnesses, and the changes in the body's balance of hormones may be involved in causing or triggering depression and anxiety. We've all heard or experienced, the famous or infamous premenstrual syndrome. So we all know that hormones do affect our moods and the way we feel and the way we see life. So hormone changes can result from thyroid problems, menopause, or a number of other conditions. Premenstrual syndrome includes a whole variety of symptoms, over 200 different symptoms, and they affect 3 out of every 4 menstruating women. So very, very, very prevalent. They tend to peak during our late 20s and early 30s, and the symptoms, of course, tend to occur in a very predictable pattern. So if you look at common symptoms of PMS, you see that tension or anxiety and depressed moods are very significant in terms of the symptoms related to premenstrual syndrome. So you see that it's not just hormonal, but it also affects your mood. Here are some definitions regarding menopause, perimenopause, and some studies have found an increased risk of the recurrence of major depression in women during perimenopause and menopause between 45 and 54 years, and it's estimated that 20% have depression at some point during menopause. So 1 in 5 women might experience depression during menopause. The rates of depression in women decrease after menopause because, of course, there are less hormonal imbalance. Hormones tend to settle after menopause. Same thing as we saw with premenstrual syndrome. In the symptoms of menopause, we see that we have sleep disturbances, anxiety attacks, fatigue, irritability, and mood swings. So we see that hormonal changes definitely also impact our moods. So how is it that hormones actually affect the brain? Well, endocrine glands within the brain function as master endocrine regulators, and they send dominant messages to the other hormone factories in our bodies. So the female hormones circulating in the body travel back to the brain, which is what we call the negative feedback loop, to provide that feedback. In some women, this normal and minor crosstalk disrupts the function of their neurotransmitters in the brain. So normally, this process of feedback between hormones and neurotransmitters happens very smoothly, but for some women, it will actually not be so smooth, especially if stress is an important factor in your life, and it will affect your mood and cause more or less profound symptoms. What's the relationship now between thyroid disease and mood? The thyroid gland is important in controlling metabolism as a whole. If it's not functioning properly, it can affect your mood. Hyperthyroidism, so the hyperactivity of your gland, might create unusual nervousness, restlessness, anxiety, and irritability, while hypothyroidism, so the underfunctioning of your thyroid gland, might cause mild to severe fatigue and depression. So patients with thyroid disorders are more prone to develop depressive symptoms, and conversely, depression may be accompanied by various subtle thyroid abnormalities. Thyroid hormone supplements appear to accelerate and enhance the clinical response to antidepressants. So all that to say that if you are suffering from mood disorders, it is very, very important that you seek professional help, because it is important to go through an extensive physical examination, because there might be some physical issues that are related to your mood. Conventional treatment of mood disorder is basically based on medications that will affect your neurotransmitters. The downside of these medications is that they can be habit-forming and cause serious side effects, and it will usually combine the medications with psychotherapy. The way we will look at enhancing mood naturally will be, first of all, by replenishing the nutrients involved in the production of these neurotransmitters. So we've looked earlier on at that serotonin, melatonin pathway, and we saw the importance of certain vitamins and trace elements, particularly the B-complex vitamins. So we will look into that. We will look into ways to balance neurotransmitters naturally. We will also seek support for adrenals and thyroid glands, because as we saw, these glands might impact our moods. And then we will improve a very, very important cycle in our body that is called the methylation cycle. So we will look into details how that crucial metabolism in our body works and can be enhanced. And then, of course, ways of managing stress. So in terms of lifestyle, the first thing I would like to stress is that it is very, very important to stick to your treatment plan. You want to prioritize your life. You want to make sure that you manage your time wisely and your energy wisely as well, because if you're constantly feeling that you are running out of time, of course that will trigger constant anxiety feelings, which then eventually might lead into depression. Daily exercise. I cannot emphasize enough the importance of exercise as a powerful stress reducer that can impact your mood, but also we've talked about exercise in every single webinar. Exercise is the most important thing you could do for yourself. Then you want to avoid unhealthy substances used, such as alcohol, drug, of course, caffeine, nicotine, because they can all worsen your symptoms of anxiety and depression. You might want to get familiarized with some relaxation techniques, such as visualization techniques, meditation, or yoga, and you also want to make sleep a priority. I've read an article recently that was mentioning that since people have internet at home, they've lost an average of 2 hours of sleep every day. That is very, very detrimental. Sleeping is so important for your health. It's a time where you detoxify. It's a time where you rebuild new muscles and new cells in your body. So it is very, very important to make sleep a priority. I would like to invite you to do that stress vulnerability self-test that we have on AOR.ca's website because it is important to develop an awareness of what are our stressors and what is our level of stress. Because after a while, when we are under chronic stress, as we saw, we go through an adaptation phase, and very often we do not realize how stressed we really are. Talking about that adaptation or that resistance phase, one way that we can work with that, because removing the stressors in our lives is often easier said than done, as we all know. If the stressor is a sick parent or child or a difficult situation at work whatsoever, sometimes we do have to adapt to that event. And one way that we can help our body to face these stresses is through the use of natural substances such as herbs and glandular extracts that help increase the capacity of the body's stress system to maintain homeostasis, which is a state of balanced equilibrium during exposure to stressful conditions. So such herbs would be, for example, ginseng or rhodiola. In terms of coping and support, joining a group would be a very, very good idea. People who share some of your stressful events. Then you want to take action. It's the fact of feeling overwhelmed that often creates the signs of anxiety and depression. So take action regarding this situation is also very important. Then you have to learn to let go. As we saw, anxiety is often related to exaggerated response. So sometimes the stressful event is not even part of our everyday life. It is in the past or it is in the future, but it is not in the now. So learning to let go is also very important. Then you want to break the cycle. For example, if you know that 8 o'clock to 10 o'clock at night is when anxiety hits you, then that's when you would like to start using, for example, a meditation technique. You want to break that cycle. Then socializing is also extremely important. Studies after studies show that people who benefit from a good network of friends or community support do much better in different situations, even recovering from diseases such as cancer. So socializing is extremely important. Human beings are social beings, but unfortunately we tend to isolate ourselves when we are suffering from anxiety or depression, which is completely counterproductive. In terms of diet, it is very important to try and eat healthy and balanced meals. So again, all the rules that apply for mood are the same rules that apply, for example, for cognitive health, that applies for heart health, for example, for blood sugar control. So you want to have a lot of fresh fruits and vegetables in your diet. You want to eat fish that are high in omega-3 fatty acids, such as salmon. The omega-3s represent about 70% of the dry waste of your brain, so they are extremely important. They are also surrounding your neurons, so very, very important to have good fish oils in your diet or fish, and to avoid saturated fats. You want to also increase all the foods that are rich in B vitamins, because as we saw, the B vitamins are very important not only for your nervous systems, but in terms of producing the different neurotransmitters. It is important to eat a breakfast that includes some form of protein. My favorite, of course, is to include a shake, for example, with our advanced whey protein as a form of breakfast. Having a good, readily available protein for breakfast will help raise your thyroid levels, which in turn may support norepinephrine and dopamine. You want to eat complex carbohydrates because they help elevate the serotonin in your brain, and remember, serotonin is that feel-good neurotransmitters. And you want to avoid foods that contain simple carbohydrates and refined sugars. They are converted into energy, eventually into fat if you're not using that energy, and they will also feed yeast. So if your digestive tract is full of yeast, such as the Candida yeast, those yeast will create excitotoxins, and these toxins will in turn affect your moods and your brain. So very important to keep the simple carbs and sugar to a minimum in your diet. You also want to avoid caffeine and drinks that are caffeine containing, and you want to make sure to have an adequate water intake, which is at least 1.5 liters of water every day. Even mild dehydration will and can affect your mood. Another point that is important mentioning is to avoid food sensitivities and dietary excitement inducers. So we want to pay attention to food sensitivities and allergens. For example, a very common one is gluten. Gluten in certain people who lack the DPP4 enzyme is not converted or transformed properly in our system, and the resulting protein is very similar in shape to morphine, so it's called an exomorphin, and therefore it can attach itself to morphine receptors and affect your mood and your brain, definitely. So this is very important. Many people are actually gluten or casein intolerant and do not realize it, and that can also cause inflammation in your gut, and then the inflammation will trigger an immune reaction, and then in turn the immune system will send instruction to your nervous system to rev up or shut down. So what's happening in your gut is very, very closely linked to what's happening in your brain. In fact, I see many children on the autism spectrum disorders in my practice, and the first intervention we do with these kids is we put them on a dairy-free, gluten-free diet, because questionnaires that have been filled out by 20,000 families over the years have shown that this intervention is the most helpful one. It will affect positively about 66% of all these kids. So gluten is a very common and unsuspected cause of mood disorders. Then, of course, we have aspartame and MSG, you know, these dietary excitement inducers that we find in food or in beverages. So in terms of nutritional supplements, we will look into about a dozen supplements that might be helpful to you. The first ones will be addressing the replenishing of the nutrients part. So we will look into the B-complex vitamins. We will look into inositol and phosphatidylserine. Then in terms of stress management, we will talk about L-theanine and osmum sanctum or olipasal. To balance neurotransmitters, two helpful supplements might be GABA and Griffo Gnaeus amplicifolia, which is a herb that is high in 5-HTP. We will also look into the adaptogens substance that we've mentioned earlier that will help support our adrenal glands, as well as thyroid support. And then we will discuss the famous Methylation Cycle and a couple supplements that might be helpful in improving that. So let's have a look again at the serotonin melatonin pathway. As we saw, we start with proteins. If you look on the left side, we have vitamin B1, B6, and zinc that are involved in the first step. Then B3, folates, iron, calcium, B6, vitamin C, zinc, magnesium, and B5. So B-complex vitamins important at every step of that transformation from protein into melatonin. Then on the right side, you have the name of the different enzymes, the stomach acid, and we also see that one of the important amino acids that also comes from our protein is methionine, and methionine is a precursor to SAMe. And SAMe, as we will see, is an extremely important substance in our methylation cycle and involved into our mood. So B-complex vitamins, they play a very critical role in producing brain chemicals that affect mood and other brain functions. So low levels of vitamin B12, for example, vitamin B6 and folate may be linked to depression. Deficiencies are common in older adults, vegetarians, and people with digestive disorders such as celiac and Crohn's disease, because a lot of the Bs are absorbed and produced in our digestive tract. So if we don't have a healthy digestive system, the absorption of the B vitamins will be greatly impacted. The advanced B-complex ADOR is the most advanced and effective coenzyme forms of the B vitamins. And this is very important because it is very common in our population that people suffer what we call SNPs, or single nucleotide polymorphism. So there are small variations on your genes that will affect your capacity to transform certain vitamins, such as, for example, folate, into their active form. So if you can get a B complex that has all these coenzyme forms of the vitamins ready to use for you, it may make a very significant impact on your life. The ratios of the B vitamins are also very important. Most B complex on the market, you will find, for example, a 50 milligram or 100 milligram concentration of all the Bs in there, or most of the Bs, when in fact this is not how they're presented in nature. So it's important to have the proper forms of B vitamins as well as the proper ratios, such as what you find in the B complex. So some of the benefits associated to B-complex vitamins, they will increase the nervous system function, they will increase the synthesis of certain neurotransmitters such as serotonin, they will increase our hormone production, our neurological health, and they also have a positive impact on reducing migraines. Other benefits are increasing the immune function, increasing the energy production. The B vitamins are actually crucial in converting your carbs and your fat into energy. So they're also involved in cellular respiration and into red blood cell formation and function. Famous vitamin B6 that I was mentioning, the pyridoxal 5-phosphate. This form, or this coenzyme form of the B6 vitamin, is 3 times better absorbed than regular pyridoxine. And this coenzyme form is involved in actually 113 enzymatic reactions, which means that if you do not have the ability to make P5P in your body, you potentially impact 113 type of enzymes in your body. So it is very, very important in, for example, the amino acid metabolism, so production of serotonin, tyrosine, glycine, and so on. Other benefits include fatty acid metabolism and heme synthesis. Signs of deficiency in vitamin B6, depression, insomnia, irritability, PMS, water retention, anemia. So as we see, a lot of symptoms related to our brain and mood are actually related to vitamin B6 deficiency. The second substance I would like to talk to you about is inositol. Inositol is actually a B vitamin-like, very simple substance actually, and it acts as a precursor to a more complex substance that we call PIP2. It's a key neuronal phospholipid that is involved in the phospholinositide cycle, and it's essential to multiple brain signaling systems. So what it does is it helps delivering messages from hormones and neurotransmitters from receptors on the neuronal membrane into the heart of the cell. So when the neurotransmitter gets onto the cell, as we saw on the diagram earlier, it will connect to a receptor on the surface of the cell, and inositol will ensure that that message goes across the cell membrane. So this is very, very important. Inositol is also an effective nutritional support for people with disorders that usually respond very well to SSRI type of drugs, but who may prefer not to take these drugs for several reasons. So we have some studies in different form of mood disorders with inositol, for example, in depression, bipolar depression, panic disorders, and eating disorders, as well as OCD. In all the studies that have been performed with inositol, we've seen significant improvement on scores, HDS, for example, which is the Hamilton Depression Scale, diminution of manic episodes, and so on and so forth. So inositol is a very safe substance and also a substance that has been thoroughly studied in terms of mood disorders. Another interesting substance that we tend to forget about is phosphatidylserine, or PS. And this is a simple glycerophosphate frame that is attached to two fatty acids and the amino acid L-serine. So it's basically a phospholipid, which means a fat that is acting as a structural component of all biological membranes in our body, but they are found in a greater concentration in your brain and your cerebral cortex. The neuronal membrane, as we said, acts as a working surface of the cell because this is where the receptors are located, and they also act as gatekeepers in terms of what substance will be admitted into the cell and which one will stay outside. So the main applications for PS are to reduce cortisol level, the stress hormone level. Of course, as we've mentioned, the best way would be to learn to manage the stress, but it is not always possible to manage or remove that stress. So in that case, what we want is to have a not as severe response to that stressful event in our life. PS has also been thoroughly studied in terms of cognitive impairment. We have at least 70 published human studies that show that we have important results in terms of Alzheimer's disease or age-associated memory impairment and dementia. And the way it will act in that case is that it will help replenish certain very important neurotransmitters such as acetylcholine. So if you have not already tried phosphatidylserine, it is a supplement that I highly recommend, along, of course, with the B-complex vitamins. Now, in terms of stress management, L-theanine is a beautiful, beautiful amino acid. It is actually quite uncommon and is primarily found in green tea. And it is actually what makes you not as wired when you're having green tea as when you're having coffee, although green tea actually contains more caffeine than coffee because the L-theanine has this very calming effect. So what is beautiful about L-theanine is that it does not have any interaction with other drugs. So if people are already taking SSRIs or other form of medication, they can still add theanine to their regimen. And it is also very safe to use in children. And the effect of theanine is actually to increase your alpha wave brain activity, which is the waves associated with the relaxed and peaceful alertness experience during meditation. So it will calm you down, but it will keep your thoughts very, very focused. So it's a very nice feeling, and it's not going to create any type of drowsiness or anything like that. It will just really, really put you sort of in a meditative state. And the reason it does that is because it increases the metabolism of dopamine and serotonin, which will then impact your learning ability and memory. Zen-theanine will also protect your nerve cells against the excitotoxins that we found, for example, in MSG or caffeine, or that are produced by candida yeast in the body. Because of its calming effect, it will have a positive effect if you have elevated blood pressure. And what is also very cool about theanine is that it acts within 40 minutes of its ingestion, and you can even speed up that effect by opening the capsule and putting it directly under your tongue. Another underestimated supplement that I really enjoy is olibasil. Olibasil is actually a plant that comes from the Ayurvedic pharmacopoeia, so it's been used as a panacea in India for a very long time, but it is not used as widely as we could in North America. So in a clinical study, we found that it has been effective in reducing anxiety significantly in a group of patients. Other benefits include lowers blood glucose levels in type 2 diabetic. It's an antioxidant, anti-inflammatory, antibacterial, antimicrobial, and antifungal, and it also acts as an analgesic. So very nice overall herb. That's why we call it a panacea, is because it impacts positively a host of functions in your body, but very, very nice to help you deal with stress. We've mentioned GABA as being the most important inhibitory or calming neurotransmitter in our body. So GABA is essentially an amino acid. It is considered a non-essential amino acid, meaning that it can be produced within our body. It's a byproduct of the decarboxylation of glutamic acid by vitamin B6. So again, here we go with our famous P5P. And what it does is it basically inhibits the activity of excitatory neuronal impulses. So when your brain is sending those excitatory signals, GABA will act to counteract that. So if you're constantly under stress, you understand that your GABA reserve will become depleted quite quickly, so you need to replenish them. GABA will also increase the alpha brain waves, a little bit like L-theanine does, and it will decrease the beta brain waves that are associated with anxiety and stress. There's a direct correlation between major depressive disorder and deficiency of GABA, and GABA is used as well in anxiety and depression, insomnia, premenstrual dysphoric disorder, and bipolar affective disorder. It is completely non-addictive, and it can even facilitate the withdrawal from benzodiazepines. But again, my first recommendation was to stick to your treatment plan, so that is something that absolutely needs to be discussed with your healthcare professional. Serotonin, as we saw, was the second most important calming neurotransmitter. The problem is that it is not well absorbed as a supplement because it does not cross the blood-brain barrier. However, 5-hydroxytryptophan, or 5-HTP, is well absorbed orally, up to 70%, and it will penetrate the blood-brain barrier to be converted into serotonin where it needs to be acting. Low serotonin levels are associated primarily with depression and anxiety, then of course insomnia, migraine headaches, etc., etc. So the supplement we have at AOR is Griffo Gnaeus simplicifolia. So it is a herb that grows off the Ivory Coast and Ghana, and we can extract 5-HTP from its seeds. In a study, on over 19 studies for depression, have evaluated the clinical effect of 5-HTP, and 50% of patients improved after only 3 days, and 80% of patients saw a major improvement within 2 weeks. And that is also very, very interesting because, as we know, most prescription medication will produce their effect after 4 to 6 weeks. So the fact that 5-HTP can act so quickly is also extremely interesting. 5-HTP or Griffo Gnaeus amplicifolia will also be interesting in terms of insomnia because melatonin is a downstream metabolite of 5-HTP. The 5-HTP was studied in migraine patients, and it was compared to a prescription medication, and in 70% of the case, it was just as efficient as the prescription drug. In terms of adaptogens or substances to support our adrenal gland, we have a very good product at AOR that is called Ortho Adapt, and it is basically a combination of different herbs such as Rhodiola rosea, Withania somnifera, better known as ashwagandha, licorice, Siberian ginseng, and glandular extract. So we're finding the adrenal extract, both part of the adrenal cortex and medulla, as well as panthetiene, which is a coenzyme form of vitamin B5 and vitamin C. So these two vitamins are the main vitamins for our adrenal glands. So for people who would rather not have a glandular extract, we have this product as a glandular-free formula called Ortho Adapt Vegan. Clinically speaking, I have seen more interesting results with the Ortho Adapt with the glandular extracts, but we do have both versions to accommodate everybody. Thyroid, as we mentioned, very closely linked to mood disorders. Thyroid will also be impacted when your adrenals are exhausted. So if you're supporting the adrenals, very important to support your thyroid gland as well. Whether your blood tests are within the normal range or not may not be so significant. So this is another issue you want to bring to your healthcare provider. So thyroid support contains tyrosine, so it's the amino acid that is the essential precursor to thyroid hormone. Contains the trace element iodine. Also, a couple herbs that have a positive effect on the hormone production, namely Coleus forcicolli and Bacopa monnieri. And we also have included some trace elements such as zinc, copper, and selenium that are important in maintaining healthy thyroid function. Now, the methylation cycle. So methylation is a metabolic process that involves the addition of the methyl groups to various molecules. So it's one of the most fundamental biological functions of the human body, and it's essential for over 100 different metabolic reactions in your body, yet most people have never heard of the methylation cycle. Homocysteine is actually a byproduct of that methylation cycle, and if homocysteine builds up in your body, it can become quite toxic at high levels. It is, for example, involved in different heart issues, but we're concerned here more with its effect on depression, and it does that by altering the functioning of certain neurotransmitters. Homocysteine can actually be recycled into various useful products by the addition of that methyl group, but if you don't have sufficient methyl donors, then homocysteine will build up in your system. So healthy levels of SAMe, or S-adenosylmethionine, will help replenish those methyl groups that are useful in removing homocysteine and will keep the methylation process robust. Now, the B vitamins, as we saw, B12, folic acid, and B6, is what will keep the methylation cycle efficient. So we have an illustration here on the right of the whole process and where the vitamins actually act in your methylation cycle. So if you're interested in the biochemistry, that might be something you want to look more closely into. But we will try and keep this methylation process simple for the purpose of today's webinar. So basically, methionine, as we've mentioned, is an amino acid that is found in dietary protein. It does bound to ATP, which is adenosine triphosphate, which is the source of all short-term energy. So this is how our cells produce energy, basically. And this bounding then creates SAMe, or S-adenosyl methionine. SAMe will give its methyl group to a methyl acceptor. For example, folate or vitamin B12 act as methyl acceptor, and it will become SAH, or S-adenosyl homocysteine. SAH will rapidly be transformed into homocysteine, and then homocysteine is that toxic amino acid that is very inflammatory in our body. Two ways we can get rid of the homocysteine is through those two pathways that are called transmethylation and transphosphorylation. So in the transmethylation pathway, homocysteine will be methylated to methionine, and that pathway is dependent on folate and vitamin B12. Folate and B12 will donate their methyl group that will be accepted by a methyl donor, such as TMG. The transphosphorylation pathway will instead condense homocysteine into cysteine through the help of vitamin B6. So basically, methionine gets transformed into homocysteine. Homocysteine gets eliminated through two pathways, one that is dependent on folate, B12, and another one that's dependent on vitamin B6. So SAMe can be given as a supplement. It is a naturally occurring substance in the human body. As we saw, it is a byproduct of methionine. And it can be involved in the metabolism of neurotransmitters such as serotonin, melatonin, and dopamine. SAMe has been studied very extensively as an effective mood support. As a matter of fact, it is a registered prescription medication as an antidepressant in many European countries. Other benefits associated to SAMe include the relief of symptoms of osteoarthritis, because it's involved in the synthesis and proliferation of proteoglycans in your joints. It acts as an anti-inflammatory as well, and it is also very important in supporting a normal liver function because it is acting as a precursor to glutathione, and glutathione, as we know, is the major detoxifying substance in your liver. So it will therefore act as an antioxidant and as an anti-inflammatory agent. So very interesting supplement. Now, we've mentioned the importance of our B vitamins in the methylation cycle. So we have here a supplement called Max Methyl that will promote the well-functioning of the methylation cycle and the recycling of homocysteine into useful products. It contains the important Bs that we've mentioned, folic acid, B6 in the form of P5P, vitamin B12 in the form of methylcobalamin, and it has also a very important methyl receptor, which is donor, which is the 3-methylglycine. So another interesting supplement to add in terms of healthy methylation process, but also healthy production of neurotransmitters. So that sums up our webinar for today on healthy mood balance naturally. Again, my name is Chantal Anne-Dumas. It was a pleasure to host that webinar. I invite you to listen to our other webinars that are archived on our website and the upcoming ones that we will be having every month. And if you have any questions, do not hesitate to contact our technical service or customer service department or myself directly. Thank you again, and I'll talk to you next month.